Welcome back. You're watching McLaren Port Huron's Today's Health, and in this segment we're going to be talking about open heart surgery with board-certified cardiothoracic surgeon Dr. Omar Habib. Dr. Habib, welcome to Today's Health.
Thank you. It's my pleasure to be here.
Let's start with, what is open heart surgery?
So you've probably heard the term open heart surgery. It's any time we go into the chest and we're doing operations on the heart. It's done for many different reasons. Some people have blockages in the arteries around their heart for which they need bypass surgery. Other people have problems with the valves or the aorta itself. So anytime you go to the operating room and get something fixed, that falls under the term open heart surgery.
When would you consider open heart surgery as a treatment immediately following a heart attack?
So when people have chest pain or are diagnosed with a heart attack, they typically come to the emergency room and are taken directly to the cardiac catheterization lab. Our cardiology colleagues will take pictures of the arteries that supply blood to the heart. If they can open up those arteries with either an angioplasty or a stent, they'll do so. If they don't think it's safe to do that, or if it's just not possible, then they'll refer the patient to me for open heart surgery or bypass surgery.
And that's obviously an urgent situation.
It can be. Sometimes people have blockages, but they're stable and it can be scheduled. Sometimes it is more urgent and it's done within that hospitalization before the patient's actually discharged home.
Can you describe that open heart procedure for me and tell us what it's called?
So it's called bypass surgery. There's two separate ways to do it. Sometimes we do it with the heart arrested or stopped. Sometimes we do it with the heart actually beating. But basically we take you to the operating room. It's a big operation. You get general anesthesia, so you're put to sleep. It's about a 5 or 6 hour operation. We open the chest and we bypass those blockages. We don't actually go in and remove the plaque, but we bypass it. I like to describe it as glorified plumbing to my patients. The heart is a muscle, just like you have muscles anywhere else in your body, and it needs blood flow and oxygen to survive. If there's a blockage, like in a pipe, it'll impair blood from flowing. So if a cardiologist can go in there and roto-rooter it out or put a stent in, he will. If he can't, then he sends the patient to me and I need to create new bypasses or new pipes. So take you to the operating room. Once the chest is open, we use veins from the leg, or we use an artery that runs under the breastbone to create these new bypasses to provide blood flow downstream from where the blockages are.
So then the part that's blocked just kind of stays in there and doesn't bother anything because now you have new blood.
Exactly. Blood tends to follow the path of least resistance. So when you have a new conduit or a new pathway for the blood to flow, the blood will go down that way. The old blockage just stays there and doesn't harm the patient at all.
Can you do more than one artery at a time?
Definitely. We try to bypass as many arteries as we can at that setting. So the cardiac catheterization will give us kind of a roadmap as to what arteries are blocked, and then we do as many bypasses as are needed. So if you get 3 bypasses, it's called a triple bypass. If you get 4, it's called a quadruple bypass. So we just do as many that are needed.
Well, I know there's a number of factors that impact recovery on a patient, obviously, but can you tell us generally about the recovery from open heart surgery?
So most people are in the hospital for about 5 to 7 days after an operation like this. The first 2 or 3 days are spent in the intensive care unit where we can keep a close eye on your blood pressure and your heart rate and monitor everything very closely. A number of tubes and wires are placed while you're asleep in the operating room. Those all come out in the first 1 or 2 days after surgery while you're in the ICU. The nurses will get you up in a chair, usually the day after surgery, and then you're transferred to one of our step-down units for the remainder of your stay. It takes a good 4 to 6 weeks, I'd say, till you're feeling back to normal, but it takes about 2 or 3 months to completely heal. So it's kind of a long process, but towards the end of that, you're back to work, you're back driving, and everything seems to be back to normal.
Can your heart become strong? Like, do you start to exercise again following open heart surgery, or how does that go?
You are cleared to exercise, and we'd want you to exercise. We do have a program called cardiac rehab that we send most of our patients to, where they can help get their strength back and get their stamina back. But once they're recovered, they're completely cleared to return to doing any activity that they were doing before.
And obviously, they're seeing their team of people that have cared for them in follow-up to their open heart surgery.
Right. So after surgery, not only will you see me or the surgeon, but there's cardiologists, there's pulmonologists, there's endocrinologists, there's all kinds of physicians who are taking care of you when you're in the hospital. And then when you're discharged, you'll typically follow up with 2 or 3 of us for a couple months, and then continue to see your primary care doctor forever.
Is there a difference in recovery when you do the open heart surgery for immediately following a heart attack? The patient's had a heart attack, they couldn't open the vessels, now you're in there doing the open heart surgery. Is that patient have a longer recovery or more difficult recovery?
It sort of depends on what his medical problems are coming into it. Typically the recovery is no different as far as the timing of surgery, but people who have urgent surgery sometimes have more medical problems that need to be addressed, so they might have a little bit longer recovery.
Now, I don't have to tell you, because you deal with this every day, these are scary times and scary procedures, and everybody wants to be at the place that does the best heart care. And I know you put a lot of focus on quality care and best outcomes. Can you tell me about how you do that?
Well, I think one of the best things about McLaren Port Huron is that we treat the patient as a team. You know, we look at each individualized patient, we try to figure out what's best needed for them, and we come up with an individualized treatment plan. And we collaborate. We work with the cardiologists, the pulmonologists, the surgeons, and we all work together to do what's best for the patient. This is what we do. We do this every day. It's very scary if you're a patient coming into it, but know that we'll treat you with our best care possible, like you're one of our own family, and really do the best we can.
Well, that is very reassuring, and this has been very helpful information. Do you have any closing comments for our viewers?
I would just say that, I'd say some of the best technology and most advanced treatment that is out there for healthcare is really available right here at McLaren Port Huron. We have experts in all fields that really work together and collaborate for the patient. Our goal is to get you through the surgery safely, get you home as soon as possible, and get you back to your life as soon as we can. And that can all be achieved right here, right in town. There's no need to go anywhere else. I think it's more convenient for patients, their families, loved ones, everyone, to get that done. And the best part is we can do it right here in Port Huron.
Very good. Thank you so much for joining us.
Thank you.
And thank you for joining us. If you have any questions about this program, you can always call us at Health Access. That's 1-800-228-1484. Or you can always go to our website, and that's mclaren.org/PH-contact. Our website is just a very valuable source of reliable healthcare information. You can order a copy of this program, watch any segment, and if you just go to our website, that's mclaren.org/PHTH, you'll find that all there. As always, we hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron.